course, this time of the year we start thinking about serious flu that goes around this time of the year, affecting people of all ages, including children. But sometimes your child's stomach ache can really signal something else is going on. Today we have Dr. Deborah Cloney, a specialist in pediatric gastroenterology, with us to help us know what to watch for and when to get help. And we should clarify for people, we're not talking about just the flu.
Right, because we all know our kids get those acute stomach aches with flu bugs and viruses, but sometimes the pain can be really persistent and become a more chronic problem, and that's what we're going to talk about.
And what are we talking about in terms of those symptoms that people really should look out for?
Well, in terms of warning symptoms for a more serious illness, the things to look for would be persistent diarrhea, persistent vomiting, continued fever, or weight loss. If a pain wakes a child up in the middle of the night, that's usually a more significant pain. Or if your child just isn't doing their normal activities, missing many days of school, not wanting to play with friends, things like that.
And then does this become something that it tends to compound on itself? Because I'm guessing if your child has diarrhea, has a hard time keeping fluids down, dehydration, all those sorts of things can even make them seem sicker.
That's very true. I mean, all those little things that happen if you start not eating as well as you should, yeah, you'll start feeling a little bit worse. And another thing that happens, I think sometimes when kids start missing days of school, that creates a stress for them, and that helps the abdominal pain become more persistent if they're feeling outside stresses.
And so what are some of the causes of this? What can create this within your child?
Well, fortunately, the most common cause of a chronic abdominal pain is what we call functional abdominal pain, which means there's not actually a disease process behind it. It really is a pure symptom. It's still very frustrating, but there's nothing scary going on like ulcers or things of that nature. The tough part about a functional abdominal pain is there's not a test we can do for it. Doctors have to determine that based on going through a thorough history and physical examination.
Is a lot of that maybe ruling things out?
Quite often it can be ruling things out, although many times we don't have to do tests to get to the bottom of it. That history and physical examination can really help us.
Sounds like a good relationship with your doctor is a good starting point, so you can share, my child had this stressful episode, or we have these changes going on in our life, and maybe that can help you with that diagnosis.
That's exactly true, and I think parents just asking their kids about what's going on in their life to find out if there are those stressful things.
Okay, is there an age where maybe you have to be more alarmed, or is there an age that maybe you tend to see this developing more?
Well, we see the functional abdominal pain more often in kids over 5. Kids less than 5 years of age, more often their abdominal pain is related to, simpler things like maybe some constipation and things like that.
Okay, so what are the kinds of treatment options then that people can do, or that you help guide parents through?
Well, there's certainly some things parents can encourage to help prevent the abdominal pain or even treat it when it happens. Common sense things, a healthy diet, lots of fiber, lots of fluid, getting plenty of rest, things like that. Avoiding irritant foods, and I like to always emphasize carbonated beverages and caffeine are some of the worst things you can take if you're having abdominal pain, no matter what the cause of the abdominal pain.
Fried food, real saucy, rich food.
Greasy, rich things quite often can exaggerate an abdominal pain as well.
And for kids, chocolate, caffeine, all that kind of stuff too.
Caffeine, the energy drinks, worst thing you can do if you're having a stomachache problem.
Okay, so if people are interested in getting in touch with you, is it something they'd have to go to their primary care physician, maybe get a referral over their pediatrician, or can they just reach out to you directly and your team?
Either, actually, but I think it's really good to start with your primary physician, because so often there are things your primary physician can address very easily. But if that's not working, or your primary physician feels something more significant is going on, we always welcome seeing patients in our office.
Thank you so much. Well, great information and really great reminders for us this time of the year when we think maybe every stomach ache is the flu. Not necessarily so.
That's so true.
Thank you so much. All right, well, we're heading to break, but we won't be gone very long, so stay right there. More of 8 West when we return.
Are you West?